They call them routine checkups, but for women over 70, some of these tests could really do more harm than good. You're told it's prevention, that more screenings mean longer life. But behind the sterile clinics and doctors' smiles is a billion-dollar system quietly pushing unnecessary tests that carry hidden risks. Radiation exposure, false positives, overdiagnosis, and even dangerous treatments that were never needed in the first place. And here's the scary part. Most older women never hear the truth. Instead, they're pulled into a cycle of tests, anxiety, and repeat procedures, all while big pharma, private hospitals, and insurance giants make a lot of money. Symptoms like chronic fatigue, anxiety, hormone crashes, and even organ damage can be triggered by the very tests meant to protect you. One test may spike your stroke risk. Another could leave you dealing with lifelong infections, all while being labeled as preventive. Shockingly, a 2021 study revealed that up to 42% of older adults received at least one unnecessary test that led to avoidable harm. In this video, we'll reveal the 5 health checkups older women should never agree to without asking serious questions. Ranked from least to most dangerous. Make sure you stick around for number 2, because it's still being pushed in every hospital, yet might double your risk of cognitive decline. Before we dive in, let me ask you 2 important questions. Have you ever wondered why some tests leave you feeling worse than before you took them? Are you curious about what cutting-edge medical research says about the tests you should actually be getting after 70? We're reading and replying to each and every comment with personalized tips and advice. Now let's start with number 5. And trust me, your doctor won't check up number 5 warn you about this one. Number 5. Bone density scans for many older women, especially those past 70. Bone density scans, officially called DEXA scans, are ordered during routine checkups. These scans are meant to detect osteoporosis, which is a condition that causes bone to become weak and brittle. While that sounds helpful, the truth is far more complicated when it comes to seniors. By the time a woman reaches her 70s, her bones naturally begin to show signs of density loss. That is expected. But there's the catch. Studies have shown that many of these changes are not dangerous enough to require medication. In fact, a 2015 report published in JAMA Internal Medicine found that over 60% of women over 70 who were diagnosed with osteopenia, which is a mild form of bone loss, were given strong medications that carried serious side effects, including jaw decay, spontaneous fractures, and esophageal ulcers. And worse, most of these women were never at real risk of a fracture in the first place. That's because these scans use a T-core system, which compares your bones to those of a healthy 30-year-old woman. So even normal age-related changes in your bones can appear alarming. Imagine comparing the skin of a 70-year-old to that of a 30-year-old and calling the difference a disease. That's exactly what happens here. According to a 2018 study published in Bone, women over 70 with no history of fractures and a T-core above 2.5 have less than a 3% annual risk of a hip fracture. That means the majority are safe without medication as long as they follow simple strength and balance strategies. If you are past 70 and have no history of broken bones, it's often better to skip the scan unless you've had a fall or are showing actual signs of fragility like shrinking height or posture changes. When needed, tests like FRA, which is a tool that assesses your real fracture risk using multiple personal factors, can give a more accurate picture without rushing to treatments. One woman we worked with, 74-year-old Margaret, who was a retired librarian and avid gardener, came in after starting on a bisphosphonate medication prescribed following a scan. Within weeks, she developed severe heartburn, difficulty swallowing, and ended up hospitalized for esophageal damage. When we reviewed her original scan, her fracture risk was actually low, and her lifestyle, which included walking, calcium-rich meals, and sunlight exposure, was already protective enough. We stopped the medication, treated her symptoms, and she's now stronger and healthier without any unnecessary drugs. And here's a little-known fact. Gentle resistance training 2 to 3 times a week has been shown to improve bone density by up to 6% in women over 70, according to a study from Osteoporosis International. No scan needed, just movement, nutrition, and time. Coming up next is a test you've probably taken every single year. but it could quietly be doing more harm to your kidneys than you think. Checkup number 4. Annual blood panels that hide dangerous kidney damage. Most older women over 70 are told to get annual blood panels. These tests usually include checks for cholesterol, blood sugar, electrolytes, liver function, and kidney function. At first glance, this seems like smart preventive care, but when it comes to aging kidneys, routine blood panels often miss the real danger and sometimes even make things worse. One of the most commonly used markers in these panels is serum creatinine, which is a waste product that the kidneys filter out. Doctors use it to estimate how well your kidneys are working. But there's what they don't tell you. Creatinine levels are deeply affected by muscle mass, and after 70, women naturally lose muscle, which can make their creatinine appear normal, even when kidney function is already in decline. That means older women may walk around with stage 2 or even stage 3 kidney disease without knowing it. A 2022 study in the Clinical Journal of the American Society of Nephrology found that standard creatine-based blood tests missed early kidney disease in over 35% of women over 70. The researchers emphasized the need to switch to a more accurate marker, called creatine C, which is not affected by age or muscle mass. Now, here's where things get worse. When these standard panels give a false sense of security, doctors may prescribe medications that are toxic to kidneys, like NSAIDs for arthritis or certain blood pressure drugs, without realizing the kidneys are already vulnerable. That can push someone into rapid decline. That's what happened to Donna, a 76-year-old retired school teacher who stayed active by walking 3 minutes a day. She came in complaining of fatigue and swollen ankles. Her regular blood panel had shown normal results 2 months earlier. But when we ran a cystatin test, her estimated GFR, that is the glomerular filtration rate, which measures kidney filtering capacity, was only 44, indicating stage 3B kidney disease. That explained her symptoms and forced us to stop a medication that had been quietly straining her kidneys. Within 2 months, her energy returned, her swelling reduced, and her kidney function stabilized. So, what is the better alternative here? If you are over 70, especially if you are thin or have lost muscle, ask your doctor for expectancy C test alongside or instead of the creatinine check. It is more reliable and has been recommended by the National Kidney Foundation since 2021 for elderly patients. One more hidden issue here. Frequent blood draws can also cause unnecessary anxiety, especially when minor abnormalities show up that don't mean anything. A slightly elevated liver enzyme or a marginally low sodium level might trigger follow-up scans or treatments that create stress without providing real benefits. Older women with stable health often benefit more from symptom-guided care. That is medical attention based on how you feel and function, rather than lab numbers alone. Next is a scan that's been marketed as a lifesaver, yet may double your risk of memory loss after 70. Number 3 is where things start to get even more shocking. Number 3, CT angiograms. After 70, doctors often recommend heart checkups. One test, in particular, the CT angiogram, which is a checkup number 3 scan that uses contrast dye to get a detailed image of your heart's blood vessels, has become extremely common. It's often used to rule out coronary artery disease, which is a condition that narrows blood vessels and raises the risk of heart attacks. But when used too freely in older women without symptoms, this test can quietly lead to harm. First, the procedure involves a strong contrast dye that must be filtered out by your kidneys. And as we discussed, aging kidneys are often more fragile than they appear on paper. If they can't clear the dye properly, it can cause what's known as contrast-induced neuropathy, which is a type of acute kidney damage. But the bigger concern, a 2021 study published in Stroke found that older adults who underwent multiple contrast scans within a 5-year span had nearly double the risk of developing vascular dementia compared to those who did not. That's because the dye can sometimes trigger tiny clots or alter blood flow in fragile brain vessels. It's not immediate. The damage builds quietly over time, often beginning as forgetfulness or confusion, and later progressing into something more serious, and most patients never suspect the scan. One patient, Teresa, age 79, came to us after her third CT angiogram in 4 years. She had originally gone in for mild chest pressure during exercise, which turned out to be simple deconditioning from winter inactivity. Each time her arteries showed no significant blockages, but months after her last scan, her family noticed memory lapses, mood swings, and difficulty following conversations. We reviewed her medical history and found no other clear risk factors for cognitive decline, no diabetes, no smoking, no head trauma. But those repeated contrast exposures stood out. We supported her with cognitive rehab, changed her blood pressure medication to one that improves brain perfusion, and helped her recover some function. But the damage was clear. So, when are these scans actually needed? If a woman over 70 is experiencing clear signs of unstable angina, such as chest pain, at rest shortness of breath with minimal activity or fainting spells, then a C-Tangog may be appropriate. But in stable patients with mild or vague symptoms, safer alternatives exist. A treadmill stress test with ECG monitoring, for example, can often reveal the same heart risk without exposing the brain or kidneys to contrast dye. Another safer option is a coronary calcium score, which is a low-dose CT scan without contrast that can measure the buildup of plaque. It is especially useful for assessing long-term heart risk and is much gentler on the body. The worst part, many women are never told about these alternatives. They trust the test without knowing it could quietly be affecting their brain years later. The system favors fast answers, but what cost? Next, we reveal number 2, the most commonly overused test in older women, still pushed in hospitals today, despite evidence linking it to massive overdiagnosis and anxiety. Number 2, checkup. Number 2, routine pelvic exams. This one might surprise you. Routine pelvic exams, which include a manual check of the uterus, ovaries, and vaginal canal, are still performed on millions of women over 70 every year, even when they show no symptoms and have no known risk factors. But according to a 2017 recommendation from the U.S. Preventive Services Task Force, there is no solid evidence that these exams in asymptomatic women reduce cancer deaths or improve outcomes. In fact, they can cause real harm. Pelvic exams can lead to false positives, which are findings that look abnormal but are not dangerous. These findings often trigger a chain reaction of ultrasounds, biopsies, and sometimes even surgeries, all of which carry risks. For older women, the risks are magnified due to age-related thinning of vaginal tissues, increased infection risk after procedures, and slower healing times. A study published in Archives of Internal Medicine found that 63% of women over 65 who had routine pelvic exams ended up undergoing at least one follow-up test that revealed no significant condition. What's worse, many of these follow-up procedures uncover what doctors call incidental omas, which are small benign growths or cysts that would never cause symptoms or shorten life. But once found, they create anxiety, and many women feel pressured to do something, even when the best option is to simply monitor. That's what happened to Eleanor, a 75-year-old former chef who came in after a routine pelvic exam, detected a small ovarian cyst. Her doctor ordered an ultrasound, then a CT scan, then finally recommended surgery just in case. She went through with it, fearing cancer, but the mass turned out to be a harmless fluid-filled cyst, which is common after menopause. She spent 5 days in the hospital with complications and needed 6 weeks to recover from a surgery that never needed to happen. The emotional toll was just as heavy. She told us afterward that she felt like a ticking time bomb only to discover there was never any danger in the first place. So, when is a pelvic exam actually needed? If an older woman has specific symptoms like pelvic pain, abnormal bleeding, or pressure, it becomes an important tool. But in women who feel well and have no complaints, especially those who have already had hysterectomy or completed their cancer screenings, the exam offers little benefit and can cause more stress than clarity. The better approach is asymptom-guided strategy, where exams and scans are only done when there's aeration. If needed, a transvaginal ultrasound can offer detailed imaging with less discomfort and risk. And newer blood tests like CA-125, while not perfect, can also help in evaluating risk without jumping straight to invasive procedures. Up next is number one, the most aggressively promoted test of them all. Yet it may quietly harm memory, gut health, and even raise your risk of sepsis. And no one is warning. Checkup number 1 seniors about it. Number 1. Colonoscopies past 70. Colonoscopy is often described as a gold standard cancer screening tool. It is recommended widely, marketed heavily, and considered a routine rite of passage once you hit 50. But by the time you reach 70, especially if you've had prior clear screenings, this test may quietly begin doing more harm than good. A colonoscopy involves inserting a flexible tube with a camera into the colon to look for polyps, which are small growths that can sometimes become cancerous. To do this safely, the colon must be completely emptied using a powerful laxative prep. And this is where things begin to unravel in older adults. The prep solution is extremely dehydrating. It flushes the digestive system entirely, removing not just waste, but also electrolytes and beneficial bacteria that maintain gut health. In older women whose hydration reserves are already lower, this rapid flush can lead to dangerous drops in blood pressure, kidney strain, and electrolyte imbalances. A 2016 study published in the American Journal of Gastroenterology found that nearly 28% of patients over 70 experienced moderate to severe dehydration after colonoscopy, pre-leading to fatigue, dizziness, and in some cases hospitalization. But the bigger danger comes afterward. The colon is home to trillions of bacteria that form the gut microbiome, which is the ecosystem that supports immune health, hormone balance, and even brain function. After a colonoscopy, especially with polyp removal, the microbiome can be disrupted for weeks. This weakens the gut barrier, which is a lining that keeps harmful bacteria out of the bloodstream. If this barrier fails, it opens the door to sepsis, which is a life-threatening body-wide infection. In fact, a 2019 report from BMJ Open found that older adults had a 12-fold increased risk of sepsis hospitalization in the 10 days following a colonoscopy with biopsy compared to the general population. Many of those cases were in people who had no prior symptoms and were undergoing the test purely as a preventive measure. Then there's the issue of anesthesia. Most colonoscopies use sedation to keep the patient comfortable. But for adults over 70, especially those with pre-existing cognitive vulnerabilities, anesthesia has been linked to short-term delirium and long-term memory decline. A study from Anesthesia and Analgesia in 2020 showed that 41% of seniors experienced measurable cognitive changes after outpatient anesthesia, changes that persisted for at least 1 month. This is exactly what happened to Joan, age 81, a retired piano teacher who loved crosswords and storytelling. She had a clean colonoscopy at age 72, but her new doctor pushed for another just to be safe. The prep left her weak and dizzy. Days later, she developed a fever and confusion. She was hospitalized with sepsis and stayed in intensive care for 4 days. Even after recovery, her daughter told us she was never quite the same. Her memory slipped, her appetite declined, and the worst part, the test didn't find anything dangerous. So, when is a colonoscopy truly needed? If a woman over 70 has never been screened before, or if she has concerning symptoms like rectal bleeding, unexplained anemia, or chronic digestive pain, then the test can still be life-saving. But for women who have had negative results in the past and have no symptoms now, especially those in good health and with a life expectancy under 10 years, major guidelines, including those from the U.S. Preventive Services Task Force, recommend stopping routine colonoscopy screenings. Safer options include non-invasive stool tests like FIT or fecal immunochemical test, which detects hidden blood and can be done at home. These tests, which are recommended annually for seniors who still qualify for screening, have shown a high detection rate for colon cancer with none of the risks associated with sedation or PrEP. So, there you have it. 5 health checkups older women are often told to take after 70, but which may do more harm than good if used blindly. Bone density scans, routine blood panels, CT angiograms, pelvic exams, and colonoscopies all have their place, but only when used wisely, and not just because they're routine. Each of these tests has the power to help or to hurt. It all depends on timing, context, and whether your body truly needs it. The most powerful medicine isn't a machine or a test. It's personalized, care based on symptoms, risks, and conversations with doctors who understand aging. Before you go, we want to hear from you. Have you or someone you love ever regretted getting a test or procedure that turned out to be unnecessary? What's one health decision you're glad you questioned or researched first? Drop your answers in the comments. We are reading and replying to every single one with personalized tips and advice to help guide you forward. Your story could save someone else's life. Thanks for watching.